Hi, everybody. I'm going to go ahead and get started here since it's a couple minutes after the hour. Probably some folks will be jumping in as we get going, but let's get started. So glad you could join me here today. Congratulations on deciding to take the time out to learn some more about what might be going on with your symptoms and what else you could do about it. I want to start, first of all, with this question to you. Have you ever experienced any of these things? Have you ever gone to the doctor and felt like you knew something was wrong? Deep down, for sure, you knew something was causing your problems, and you were just dismissed as this is normal for aging, or this is normal after having a baby. Have you been told to just take this antidepressant, for example, for gut problems or fatigue without really getting a good explanation? Have you experienced limited efficacy from your medications or treatments and bad side effects? Have you wondered what other options were available and not been given any great suggestions? And one thing I find a lot of people experience is they really know there's a deep down reason something's wrong, and they want an answer to that, and they're not getting that at all. Just raise your hand, or rather enter in the chat box if that's something that you've experienced. Go ahead and share if you've had any of these problems. Maybe you've been confused by conflicting online health information. I'm going to go ahead and just turn off the video to help us all focus on the slides. Or have you lacked a guide or a plan? Sometimes we get going down a lot of rabbit holes trying to solve our problems, and we end up going from one potential solution to another, but without any clear plan. If that's you, let me know. I see some of you typing in that, yes, you've had that experience of being dismissed, or you've just been given medications like a Band-Aid and it's not really solved the underlying problem, and you haven't been given a real clear answer. Well, that is the number one thing that I see when patients come to me. And what is the cost of that problem for you? Oops. How do I go back? You know, we really often don't think about this, but what is the actual financial impact of having these symptoms that nobody's giving you an answer to? What does it mean when you don't have energy and you can't do your best at work, or you can't care for your children as well as you want to? What about medications that you're put on that have expensive co-pays, or maybe they're not covered by your insurance? Some folks with autoimmune disease are on really expensive medications like, for example, Humira, that are costing $1,500 a month in their copays. What about what they could be missing out on, what you're missing out on in terms of maybe you can't travel or participate in family events anymore, or there's activities you'd really like to do and you just can't because of your health? Are you feeling hopeless and like something's wrong with you? What's the cost of that? Feeling really depressed about it at this point, or frustrated with doctor visits and referrals to specialists, like an unending sort of chain of attempts to be treated without any good resolution? Are you wondering if you're ever going to feel like yourself again? What is the cost of that? Well, again, congratulations on being here, because we're going to start to look for some answers to this and see what we can do to change that future and those costs. I want to start first with my journey and how I got to be here as a functional medicine provider talking to you right now. I went to medical school because I really wanted to help people and learn why. Why do people get sick? What's going on in the body? I wanted to understand that biology and get answers. And at first in medical school, I got to really ask that a lot. And I did learn a lot of interesting things. But as the training progressed, it became more about labeling an illness with a diagnosis and then matching that to some pharmaceutical. We call that in functional medicine a pill for an ill, or name it, tame it, and blame it. And this was really not satisfying after a while, because again, why is this person having this? What's going on, beyond just a superficial answer? And I saw how medications were limited in their efficacy and not really resolving the root problem that we didn't know what was causing the problem in the first place, and causing a lot of side effects, and patients were not satisfied, often ending up on numerous medications. Well, when I was a resident physician after finishing medical school, through my sister's health journey, I ended up coming into contact with some really important information on nutrition. And this really changed the whole course of my life, really, as well as my career. I began to learn about the amazing research on nutrition and lifestyle changes and how chronic problems, chronic inflammation, nagging symptoms can be changed with some very simple lifestyle nutrition changes. I really delved into this research, and it became my big hobby, just reading all the time about nutrition. And in the course of that learning, I started to hear reference to this term functional medicine. And I also heard amazing stories of people with pretty severe illness like autoimmunity reversing their symptoms because of changes they made in their diet. And that was something I almost couldn't believe, because in medical school, all we'd learned was that people take really strong medications like prednisone, or biologics like immune suppressing drugs, or basically chemotherapy like methotrexate for these autoimmune diseases, and they're really sick and the prognosis is not good. So how could it be that something so simple could change things? I had to learn more about this. And I honestly became pretty mad. Why hadn't I learned any of this nutrition in medical school? I mean, medical schools really teach very little nutrition, and my school taught more than most, but it was still focused on extremes of health conditions, like if you get no vitamin D, then you have rickets, for example. Well, that's not really a problem we are encountering in our society today. But what about chronically slightly low vitamin D? What kind of impact does that have? Well, there's amazing research on this, but none of this was taught to me in medical school. So I was pretty frustrated. I decided I needed to study functional medicine in earnest because it was life-changing information, and I felt that patients needed to know this, and I wanted to bring this to my practice and to my community. And the more I learned, the more I realized I needed to align my work with those beliefs. I opened my private practice for that very reason, having previously been a hospital-based psychiatrist, and began to be able to work with patients one-on-one in this way that is so very powerful. I felt I had a moral obligation to practice this way and to share what I've learned. And the journey to transition to this kind of practice has been so worthwhile, to see the power of this approach every day with my patients. So a little more about me. I'm the founder of Catalyst Health Center for Functional Medicine. I'm an honors graduate of UC Davis School of Medicine, and I've been certified by the Institute for Functional Medicine as a practitioner. I've done some additional training as well in evolutionary approach to medicine. So through applying what I've learned to my own health and through my work with patients, I developed my 5-step approach for creating lasting health and vitality that I'm going to share with you today. There is another way. I'm excited to share it with you. In my practice, I help people who are searching for answers to frustrating symptoms that their doctor can't explain or fix, and who are feeling depleted or stuck, to transform their health through natural, personalized treatment plans so they can resolve their symptoms, feel vibrant again, feel confident in knowing how to keep themselves healthy, and feel great. So today, what you're going to learn is, first of all, what is functional medicine? I'm going to explain this more. I'm going to explain how it's different than our conventional model. And today, we're going to really focus on one piece that's so key in functional medicine, and that is one of the biggest things that people are blown away to learn about and the impact it can have on their health. And then I'm going to share with you my 5-step approach to lasting health. My hope is you're going to have a whole new view of what creates health after today, and you're going to be empowered to improve your health and that of your clients with tools your doctor might not even know about. In fact, probably doesn't. You'll have steps that you can start taking right away to improve your health after today's webinar. And I also promise to show you at the end how you can take today's useful information and turn it into really a lasting transformation in your life. So I want to begin with a case study. This is a patient who came to me with severe anxiety and panic attacks despite being on the standard treatment, Lexapro. That's an SSRI antidepressant and anti-anxiety medication. She'd gotten a little bit of benefit from it, but it really didn't resolve her symptoms. And she also had severe irritable bowel syndrome. She was having diarrhea frequently and had to run to the bathroom with very little notice. And as a result, had to plan her whole life around where is the next bathroom. She was someone who previously had loved to travel, but after getting IBS, she wasn't able to do that anymore. Between that and her panic attacks, she couldn't get on a plane. She couldn't go anywhere where she didn't know right where the bathroom was going to be. This is a patient who worked with me one-on-one in my 6-month program. And this is what happened. Her panic attacks resolved, her diarrhea resolved. She weaned off her medication, and she's living the life she wanted to be living the whole time. She's traveling, she's spending time with family, traveling, she's enjoying herself and no longer living her life around where the next bathroom is and living in fear. So how did she get better? We're going to revisit her story later, and I'll show you how. So I love this quote because this is the thing that really, the paradigm shift I experienced when learning about nutrition and functional medicine, and that is that we are supposed to be healthy. The body is always trying to heal itself. We have to give it what it needs and get out of its way to do that. And I'm going to show you how today. So what is functional medicine? Functional medicine focuses on identifying the actual root causes of symptoms rather than focusing on the symptoms. And I have here a diagram of a tree because our current model really works up there in the leaves and the symptoms, like addressing those suppressing symptoms. Whereas we go down into the roots in functional medicine to find out what is even creating those symptoms. The Institute for Functional Medicine, where I trained, grew out of the energy and dedication of the founders who had a vision of bringing to clinical medicine the emerging evidence and insights to enable it to move from a drug-based model of fighting infectious disease that had worked so well a century ago to a systems-oriented, patient-focused clinical model designed to reverse the growing chronic disease epidemic, as opposed to the acute infectious disease problems we were faced with before. The founders recognized that today's most prevalent health issues are mostly caused by the interactions between genetics, lifestyle choices, and environmental exposures, and that treating them requires an understanding of these interactions and subsequently using that understanding to design appropriate treatments that are personalized to each individual. So the key concepts in functional medicine are that unlike acute infectious illness that was really the big problem 100 years ago that we were fighting, chronic illness, which is our main problem today, has multiple causes. And there are different sets of multiple causes for different people for the same diagnosis. There's also common patterns. So common patterns of inflammation and different individual biological differences and dysfunction can show up as different symptoms in different people. So the same inflammatory cause can result in depression in one person and maybe, for example, migraines in another person or joint pain in another person. Another key concept of functional medicine is the microbiome. That's the bacteria living in and on us, and also the viruses and the fungi. And we're going to talk about that more in depth in this webinar. Genetics is also very important. The concept of individual bioindividuality and how that affects systems like detoxification and cellular energy. Cellular energy production is very important in functional medicine. This is really understanding that the biochemistry of each cell is at the root of it, that functioning well is at the root of so many problems. Detoxification is key. Everybody is detoxing every day, and they have detoxification systems that differ based on their genetics, and optimizing that is really important for health. Finally, the role of the environment. And just for a minute, I want to expand your concept of what the environment is. This is not just the air and the water around us, but it's also the food we're eating every day. It's whether or not we are moving and active. It's whether we have joyful relationships or toxic relationships, whether we play, how much we sleep, our light exposure. All of that is part of the environment. And in functional medicine, we recognize that plays a key role. Okay, so now we're going to dive into the focus topic for today, the concept of the gut. this is such a great place to start with understanding functional medicine because it has such an impact. And it's hot right now in the news. You may have been hearing about microbiome and gut and want to know more about it. Well, in functional medicine, we're really experts in this. I want to start with this diagram here. And I first tell you kind of a funny story. When I was picking a diagram for this slide, a lot of the photos were just cut off at the neck. The diagrams were like the head was not part of digestion. And I think this is almost symbolic for how our culture is today. Like we don't recognize chewing as important. We don't recognize the role of the brain in digestion. So I want to take a minute to talk about that. Before I do that, I'm just going to say that most of our immune system is housed in our gut. And so when the immune system is triggered by what's going on in the gut, that is a huge source of inflammation. And I'm going to be talking about inflammation a lot today. And it's through this connection that the gut is so key. So the GI tract, as I mentioned, it starts in the head. The parts of the GI tract are from the mouth through the esophagus down into the stomach. And then the small intestine begins there, going on to the large intestine. And digestion starts with smelling the food, seeing the food, which triggers the release of stomach acid and saliva with enzymes that break down carbohydrates. And then chewing the food. We have a tendency to really wolf our food down in our society and multitask while we eat. And this is right where digestion begins to go awry. When we swallow our food, the food is mixed with the stomach acid. And if we don't have enough stomach acid, this is another place where the system gets off track. If the food is not acidified properly, when it goes into the small intestine, the digestive enzymes won't be released from the pancreas. Without digestive enzymes, the food cannot be broken down further. That unbroken down food is the bacteria that should not really be in your small intestine, but can be, will really have a field day with that undigested food. So you want the food to be digested into the tiniest possible form with the digestive enzyme so it can be absorbed in the small intestine. The undigestible fibers that we eat and should eat pass on to the large intestine where the microbiome is largely housed, and then they digest that fermentable fiber at that point and provide they have multiple important roles in our health. So that's kind of an overview of the digestive system. I want to talk a minute now about this term leaky gut. How many of you have heard of leaky gut? Just say yes in the chat if you've heard about leaky gut. It's kind of a popular term right now. What does it actually mean? Well, the real science term for this is increased intestinal permeability. So the intestine has a pretty complicated job. It's a huge surface area with all the little folds and little finger-like projections called villi. The surface area of your gut is about the size of a doubles tennis court. Its job is to decide what comes in and what stays out. I tell people sometimes, my patients, you're like a donut. The inside of you is actually still like the outside because we're eating things from the environment where things are entering into the GI tract, and that it has to decide what is a foreign invader that should not be allowed into the system and what is food that needs to be absorbed. So the system has these tightly packed epithelial cells. Those are those pink cells with the little finger-like projections on them. And they're connected through that thing called the tight junction that you can see on the diagram. However, different factors, including improper bacteria in the gut or stress or certain food triggers, can open up those tight junctions. And you see what happens there on the right when that happens. You get undigested food particles entering into the bloodstream. You see pieces of bacteria entering into the bloodstream, and that's where that immune system is waiting to attack anything that shouldn't come in. So it gets really triggered and turned on, and that inflammatory process is started when the bacteria or food particles or toxins are entering the bloodstream that should have been kept out by an intact gut lining. So you can start to see here how that might be a bad thing. That huge immune system housed in the gut getting turned on and triggered and really going into attack mode. So the microbiome, what is it and what's it for? It is, as I mentioned earlier, it's the bacteria, the fungi, the viruses that live inside and on us. The majority of the microbiome is in our gut. It is in other places, of course, like our nose and on our skin, but this is the main location. And really, it's about like 2 to 3 pounds worth of bacteria primarily that make up the microbiome. What's it for? It has so many important roles, and every day there's a new research paper coming out about what it does and how it interacts with our system. But to summarize, the bacteria are breaking down those fermentable fibers, and they're producing things called short-chain fatty acids that provide fuel for the cells of the large intestine and fuel for other healthy bacteria. They're detoxifying for us. And they're creating chemicals that are interacting with our immune system and interacting with our brains. So beneficial bacteria are sending signals that are telling the immune system to be calm, that everything's okay. They're telling our brains that things are good. But when the wrong bacteria are there, you can imagine those signals get disrupted. So the microbiome and problems with the microbiome are linked to a host of diseases, including neurodegenerative diseases like Parkinson's or Alzheimer's, and autoimmune diseases, as well as depression, anxiety, and a whole host of mental health issues. Also strongly linked to autoimmune diseases. So where do we get our microbiome? Well, it actually is designed very cleverly. The baby gets the microbiome when it passes through the birth canal, and the mother's gut flora actually change in the weeks approaching the birth of the baby in preparation for this. But if a baby is not born vaginally and born via C-section, you can see how it would actually get different microflora, as we say. It would be picking up the bacteria that are on the surfaces in the hospital and on the hands of the nurses and stuff in the hospital, even with the gloves that they're using. So that's a very different microbiome, and it's one of the reasons that C-section birth raises the risk of various things such as obesity, and we see a different microbiome in babies born via C-section. It also comes from breastfeeding. In the breastfed babies, they're receiving bifidobacterium, some of the first bacteria you get as an infant, in the milk. And the breast milk itself is designed to promote the growth of the right bacteria. So formula feeding also shifts the microbiome. The microbiome is changed by things like antibiotics. Some antibiotics are very broad spectrum and can really knock out a lot of the microbiome. There are, of course, times where antibiotics are life-saving, but they do tend to be overused in our society, and repetitive bouts of antibiotics are going to have an increasing impact on the microbiome. And finally, the food we eat has an enormous impact. The microbiome can shift in its components within a few days of changing your diet. And eating a diet full of processed foods that is typical in our country really encourages the growth of bacteria that are problematic and not the beneficial bacteria. So what do we do about this? How can we fix it? Well, one of the things we can start to do is support digestion. Like I talked about at the beginning, we can make sure we take time to be quiet when we eat and like observe the food, smell it, start that process of releasing stomach acid and digestive enzymes, and then to take the time to chew. We can do a elimination diet to identify any food triggers that are causing us, any one of us in particular, symptoms. Sometimes a food that's even normally very healthy could be a trigger, and you never know until you eliminate it for several weeks and then reintroduce it, whether or not it's been causing problems. We can feed that microbiome. I mentioned earlier that processed foods really contribute to the growth of the wrong bacteria, the ones we don't want to promote. Well, the inverse is also true. If we eat lots of vegetable fibers and a wide diversity of foods, especially vegetables, we can promote the growth of the beneficial bacteria, especially the bifidobacteria and the lactobacilli that we know are so critical for our health. However, we may also have hidden gut infections that, unfortunately, these steps won't resolve. And that is where a healing protocol and testing are so important. We can add healing nutrients on our own, such as bone broth, and we can work with practitioners to get a robust healing protocol in place that can make a huge difference. One of the key things I do in my practice is test for gut pathogens. It's quite remarkable what I find. I find a wide array of protozoal infections, weird things that you didn't think you would have, like Blastocystis hominis, and they've other interesting names like Cryptosporidium. I've found a few worms in several patients, and these can cause a lot of trouble with gut health in terms of the motility, and a lot of folks have constipation with these, but some people, they have silent gut infections. So they have that infection and they don't notice any symptoms in their gut, but their primary symptom is fatigue or depression. And that is because of what's going on in the gut. I want to take a minute and talk about a patient of mine who came to me with anxiety and depression and severe constipation. So severe, actually, that she only could go to the bathroom every 3 days. And when she did, she would actually vomit because of this discomfort of her constipation. On testing, we found a Pseudomonas bacteria overgrowth, and this was causing the problem. And when I treated this with her and did a gut healing protocol, she came in and said that she goes to the bathroom every day now, and she does a happy dance every time she goes because it's such a relief. There's no pain, there's no vomiting, she's normalized. And, getting back to one of the earlier topics I mentioned that's key in functional medicine, detoxification. Part of detoxification is regular elimination, regular bowel movements. So you can imagine if you're not going to the bathroom every day, these toxins are building up in the body, and just think about the impact that's having on all the body systems, including the brain. So working on that gut health for this patient was so critical, and for most of my patients is a really key piece to transforming their health. So here's another quote from one of my favorite guys, Hippocrates, because he was so right. Let food be thy medicine, and medicine be thy food. And that's what I practice. So we've covered a lot today. I'd like to show you, today we've talked about some of the most common issues in the gut that lead to inflammation, and you've hopefully gotten to see how the gut is so related to health of the whole body through that activation of the immune system, through when there's a leaky gut and you've got triggers entering the bloodstream and turning on the immune system. And I've hopefully also shown you how there's connections between an imbalance of bacteria and various symptoms in the body, even ones outside of the gut. And because of that awareness, you can see now how this inflammation really underlies probably most pain and symptoms that people are experiencing. And I hope now today I've given you some things that you can keep your eye on, that you can now be aware of, and I've shown you just how powerful they are and why they matter so much to your health. And now you'll be more empowered to stay aware of these symptoms and to the connections, and start looking for those connections between what you're eating, how you're moving, what your environment's like, what's going on with your gut and your symptoms. Here's the thing though, if you focused on this awareness that we've created here, you would have already tackled a lot in terms of the issues, in terms of understanding the issues of what's going on and how it impacts your body. But if that's where you stopped, you might never find out what some of the hidden causes were of the symptoms. And I want to talk with you now about the process I would take someone through, so at least you know what the next steps would be. So my 5-step approach that I've created, I call the SPARK method. And that's because we like to catalyze health transformation here. That's why we have our name, Catalyst Health. A catalyst is something that makes a process or reaction easier. And that's what we strive to do here, to help you with your change in your, to transform your health and incorporate lifestyle nutrition factors, but make it easier to do and give you the support and the guidance to make it really clear. And the first step of that SPARK model is to see the connections. And that's what we've been starting to do here during this webinar, understanding how the lifestyle choices, how the nutrition is actually directly influencing health. And I spend a lot of time one-on-one with my patients going over their functional medicine timeline in that first appointment to show the connections of in their own story where we may find certain triggers that have been, and mediators that have affected their health. Once you know these connections, you're empowered to start acting on that information with your lifestyle choices. The next step is to test. Testing for hidden causes. Really, as a functional medicine practitioner, I'm like a detective. I'm looking for the hidden causes that people haven't looked for. I tell people it's like a look under the hood. Find out what's going on underneath that people may not have thought was connected that is causing the symptoms. Once we have that testing back, I go over that in detail with my patients so they can really learn what are those causes. And I take the time that unfortunately our current model does not support in conventional medicine, which is the time to teach patients and to get your questions answered. And from those testing results, I create a personalized treatment plan. That is going to address things like that, like those gut imbalances I referred to, or gut infections that we might find. Based on the testing results, I add in what is missing. This can be often certain nutrients that we identify as low that we need to replenish. It can be movement, or it can be other stress reduction techniques. What is missing to help rebalance the body systems? And we also remove the blocks. We treat the overgrowth. We remove the toxins, identify what could be a source of problems. You know, maybe there's a certain food that's a real problem that we need to remove, or maybe there's a toxic exposure in the home that we have to address. So we remove the blocks to healing so that the body can do what it's already trying to do, which is to heal. And finally, the last step I call keep it up. That's where we retest to make sure we've accomplished what our goal is, and further personalize the treatment plan if there's anything else revealed. And then we transition to a maintenance plan to stay healthy. It's just a review of my 5-step approach. Again, is see the connections, personalize the treatment plan, add in what's missing, remove the blocks, and keep it up. So there are ways to send out for some testing on your own, and some people do this, and you certainly can. But there's a few problems with this that I want to point out. And here's what I believe that what I do is more powerful. I don't believe doing your own testing serves you because you aren't getting any professional advice or guidance or interpretation of the test. One of the big problems with our current lab testing is it shows you disease ranges of lab values. So if a test comes back stating it's normal or in range, that means it's not identified as a problem from a disease point of view, but it doesn't tell you if your lab results are actually optimal. And that can be really key. People can have a whole lot of symptoms from suboptimal lab results that would not be flagged as abnormal in standard testing. Working with a practitioner, frankly, saves people years of time and sometimes thousands of dollars. It's really hard to estimate the cost of the lost productivity, the lost, the relationship impacts when you're ill, the loss of vitality and joy to one's life. So I definitely recommend that one work with a practitioner to get the most direct route to wellness. There's so much information online, and a lot of it's really great, but it may not be the right information for you. So I just want to take a minute again to encourage you to think about what is it worth to invest in your own health. I think we always think in terms of the insurance model, is this covered? But our current medical model and insurance model is really a disease management model. It does not allow for preventive care. It does not allow for really identifying root causes, which is unfortunately really kind of crazy to me because that is medicine. Functional medicine is medicine as it should be practiced for chronic illness. And it doesn't allow your practitioner to spend the time with you to really listen to you and hear what you think is going on and to piece it together. We've really evolved into this very sad system of very short visits that are directed at finding, like I said, a pill for an ill. So and the cost of that is really, for some folks, really devastating. I want to get back to that case study I mentioned at the beginning and how my patient got better. Just to remind you, she was on Lexapro, the antidepressant and anxiety medication, but was still experiencing panic attacks and anxiety. She had diarrhea that was really ruling her life. And when in reviewing her history, it became clear that a big piece of the puzzle was that she'd had her gallbladder removed maybe about 10 years before. And this, in the functional medicine timeline, we were able to see that this was the trigger that led to subsequent nutrient deficiencies, because now she wasn't able to digest fats well, and that included fat-soluble vitamins. And this led to dysbiosis, that's that imbalance of bacteria in the gut. And on stool testing, we saw several overgrowths that needed to be treated. So the personalized treatment plan for her was working on the stress response. That's that HPA axis I'm writing about there. That's the hypothalamic pituitary adrenal axis, which I'm going to cover in a future webinar. But that's the stress response. And that plays into the gut. And again, I'll go into that in a future webinar. But working on stress management was a big part of it. Improving blood sugar regulation was a key part of her source of inflammation that we found on testing. Improving her digestion, replacing those that bile that was missing from the gallbladder. How was she going to digest fats? Well, we worked on that and improved her digestion. And we treated the gut pathogens and imbalances. And then we transitioned to a maintenance plan. And that's what it took. And it was only several months till she was a new woman. So I want to take a minute and say, what is next for you? We've covered a lot today, and I know it's not easy to make changes, and that's why I have a passion for helping people, supporting them to achieve their true health so they can stop just surviving and start thriving. I've mentioned already that I have a 6-month program where I work intensively one-on-one with patients to transform their health through advanced testing and personalized natural treatment plans. So right now, I want to invite you to take me up on an opportunity. I want to invite you to go to our website and click on Schedule a Consult and talk to my patient coordinator to see if you qualify for a complimentary vitality strategy session with me. I love doing these sessions where I get to talk one-on-one with you and find out what is your health challenge, what are you struggling with right now, and what are your goals. And I help you in that session figure out what is your next best step for changing your health and reaching those goals. And that's an opportunity also where we can discover whether it's a fit to work together. So I really encourage you to take me up on this right away. I have limited time available for these strategy sessions because I'm busy working with patients. But I encourage you to go there. So the link is Catalyst Health CFM, that's Center for Functional Medicine.com/discovery/ consult. But you can also go on the website, you'll see where you can just click schedule consult. At this time, I would really love to take questions. If you want to type your questions in the chat, I'd be very happy to answer them. I'm sure some things came up today when we were talking about when I was discussing the gut and the connections there, and some of that can take a while to absorb, and you probably had some questions. So please let me know what I can answer for you. So there's a question about probiotics, and this is a question I get quite a bit. With the role, the utility of probiotics. There's certainly a lot of ads these days for probiotics, and there's good research around these as well. So yes, probiotics can be very helpful, and this is because the beneficial bacteria, as they pass through the gut, the ones you take in a probiotic, they influence the environment of the gut. They're influencing the health of the gut lining. They're interacting with the other bacteria there, and they exert their effects that way. But it is very important to know that probiotics do not actually take up residence in the gut. They pass through. There's not a way to get them in high enough quantity through that way to actually change the gut. So what they do, they're very helpful still to take. And I'm not discouraging you from trying them, but just understand that like when you stop using them, the benefit goes away because they haven't actually sort of seeded and colonized the gut the way people imagine them to do. And that's why doing a full gut protocol, identifying pathogens and imbalances, treating them, and doing a number of steps that at the same time will foster the growth of your own beneficial bacteria is really the way to get lasting change. I thank you all so much for joining me here today, and congratulations again on taking the time to really learn more about what you can do to transform your own health and be empowered to get well yourself. Again, I encourage you to take me up on my offer for a complimentary vitality strategy session by scheduling a consult on our website to talk to our patient coordinator. I look forward to talking with you soon.